Good evening, New York City, and thank you for tuning in tonight. My name is Solomon Acevedo. I use he, him pronouns, and I'm the Deputy Public Advocate for Justice, Health Equity, and Safety. And we're so grateful to have folks here tonight to be able to tune into a conversation of much importance, one that is often overlooked, and trying to highlight and center from a health equity perspective the reality of a need for more birthing centers and to discuss also the future of maternal health. And so we're so glad to be able to convene a panel of experts in their field who have been working hard, who have their own personal lived experiences, and are willing to share with our city the truth about what can be done to improve conditions here. And so thank you for tuning in. I'm so grateful. And I am going to kick it off to my colleague, Farine Griffith, to introduce herself and get the show on the road. Hi, Farine.
Good evening, everyone, and welcome again. My name is Farine Griffiths, and I'm the community organizer for Civics and Community Empowerment, which also includes outreach, organizing for maternal health. Thank you for joining us this evening. We want to start with our panelists. We have some great panelists to share the importance of having birthing centers in New York City. So we're going to start first with Olufemi, Yeshua L.
Hi.
Go
ahead.
No, followed by Shawnee Benson Gibson. Go ahead.
Okay, thank you. Hi, everyone. So Chief Justice Olufemi Yeshua L. I'm an infant toddler specialist, also a professor in the early child education department of Borough of Manhattan Community College, and also on the board of Haven Midwifery Collective.
Greetings, everyone. Greetings, family. My name is Shawnee Renee Benton Gibson, and I am the co-founder of the ARIA Foundation and CEO of Spirit of a Woman Leadership Development Institute. And I'm also part of the award-winning documentary Aftershock, one of the subjects of the film, and looking forward to having a conversation about the need for birthing centers in this city. I'm grateful to be here.
Thank you both. Thank you both. Next, we'll hear from Linda and Amaduma, Barico, and then followed by Alexandria and Trinisha.
Hi, I'm Linda Harrell. I'm a midwife here in Brooklyn for the last 35 years. I'm also on the board of Haven Midwifery Collective. I have been doing birth work for over almost 43 years now. And I am very passionate and committed to it. I'm excited to be here tonight and excited to finally be heard. Yay!
Thank you for joining this discussion. Amaduma Bediako.
I'm sorry, my sound is not clear, but I heard my name, so I'm assuming you want me to introduce myself. My name is Amadoma Bediako. I've been doing birth work since 1977. I'm a doula trainer and a childbirth educator and lactation counselor. And I think it's really important that we make sure that the communities that are underserved have the opportunity to have support when they're birthing. And I think that if we work together and we collaborate, we can make a change in improving the maternal mortality and morbidity in New York City in particular.
Thank you. Thank you for joining us in this discussion. Shakima Wiggins.
Good evening, everybody. My name is Shakima Wiggins. I'm a nurse midwife here in, well, I guess I represent all of the boroughs. I've lived everywhere. I currently work as a professor at SUNY Downstate in the midwifery education program and proud to be educating up and coming midwives. I am a colleague as well of Trinisha Williams. And I have purposely focused my practice more so on the other aspects of midwifery care, highlighting lactation and childbirth education. So I choose to look at outcomes and how I can best impact those outcomes related to Black infant mortality in addition to maternal mortality and morbidity.
Thank you for joining us, Alexandria.
Hi, everyone. My name is Andrea. This is my son, Obadiah. I am an early intervention service coordinator. I'm a mother of two. This is my youngest. I live in Brooklyn, New York. And I'm also a part-time vlogger. I like to highlight my motherhood journey, and I definitely highlight my experience giving birth in birthing centers. So I'm a proud advocate of giving birth at birthing centers.
Thank you for joining us. Finally, Miss Trinisha Williams.
Hi, everyone. Greetings. My name is Trinisha Williams. I am a certified midwife and a strong advocate for birth center care in New York City. I've been a midwife for about 20 years. I've had experience in hospitals, homes, as well as birth centers. And I welcome you all here. And I encourage you to consider at the end to follow Haven Midwifery Collective on Instagram so you can know about all the things we're doing.
Thank you so much, ladies. This is a very important conversation. We all know the disparities that face Black women and, to have healthy outcomes during birthing process. So I want to start with a general question, since all of you are you're impacted and you're advocating for change to close those disparity gaps. What drives you to want to do the work in maternal health? And we can do popcorn style. This is a question for all, so we can do popcorn style.
So sorry, for a moment you broke up. Repeat the question, please.
The question is, what drives you to want to do this work in maternal health?
Okay, thank you. So for me, as I mentioned, I'm an infant toddler specialist. I'm also a diversity, equity, and inclusion strategist. And I think it's important to have families understand there is an intersectionality between the birthing process and early childhood. So what happens during the birthing process impacts families once the babies arrive and when they get to school. And so having educators support the birthing community is very important. And also looking at the systemic racism that exists within the birthing space is also important. And those are the two things that drive me: the connection, as well as wanting to help change some of those numbers with the systemic racism and the high infant mortality rate that still exists 20 years later.
I guess I'll go next. What drives me is to talk to the pregnant and birthing people and to hear their stories and hear their traumas and see how I might be able to best advocate for them and support their birthing needs, as well as to maybe actually make some dents in this disparity, whether it's access to care, whether it's midwifery care or doula care or lactation services. I'm just committed to the pregnant people that are around me. And every time I come in contact with a family who has another trauma, another story, I'm more motivated to make the system work better, to improve outcomes for them.
I'll share. Yes. So my own journey as a Black woman giving birth in the United States was harrowing. There were many moments where it was touch and go. And after I had each one of my children, I experienced postpartum depression, and after one of them, postpartum psychoses. And then thinking about the lineage in my family on my mother's side that runs in the family. And then, of course, many of you know that I lost my daughter, my eldest daughter, Shimani Makiba Gibson, at age 30, giving birth to her second child. She died 13 days after due to a preventable death. It was a birth-related pulmonary embolism. And so I'm here for my family. I'm here for my ancestors. I'm here for my grandchildren that are left behind, if they choose to partner with someone or give birth directly. And then also I'm here for my community at large, because I view this as an existential crisis. If we can't give birth safely, then we need to be concerned about humanity continuing. And I'm complete.
I'll just say I just strongly believe that maternal child health is at the root of everything. I mean, when we look at healthcare, or, the medical system. Maternal child health to me is just what makes the world go round. And we have to look at how we're supporting our moms and pay more attention to what we do with the children, with our babies once they get here. And we're all familiar with the disparities that exist. So I'm oftentimes wanting to work with people on action. What actions can we take? It's not enough to just keep identifying what the problem is, but what can we do about it? And so I'm really proud to be involved in this work with some of these great leaders in the community, because it's definitely overdue. It's overdue in terms of being time to start making moves. And this is one of the ways in which we can do it.
Absolutely. Alexandria?
I'm sorry, what was the question again?
What drives you to want to do this work in maternal health?
What drives me to want to do the work is, I know growing up, I would go to the hospital as a place of emergencies. And I noticed that as I've grown older, a lot of women continue to have C-sections. And I'm just like, why is nobody giving birth naturally anymore? Why is everybody having a C-section? Why is everybody who was having a perfectly normal pregnancy all of a sudden having these emergency C-sections? So after going the route that I went, which was with the birthing center, I realized that a lot of women are not educated. And I wanted to stand in the gap and educate as many people as I could with my own experience.
Olufemi, did you respond?
Yes, I did.
Okay. Miss Trinisha, I have a question for you. Currently, New York State has 3 birth centers. How has not having access to birth centers care affected the community you work with?
Well, I would start with one of the basic things is that some folks are not able to actually birth in their homes. While community birth is home birth as well as birth center birth, we don't have enough to meet the needs of New Yorkers. We have 8 million people in this city alone. This just in the 5 boroughs. Why don't we have greater access? And when I've worked with families that are housing insecure, or maybe are small apartments where there's several family members deep, they want another option. And that option would be that of the birth center. While we do have hospitals in every borough, the access to be able to get a birth center birth is very limited, particularly if you're not in one of the areas that in which there is a birth center. Some of our folks up in the Bronx or even in Queens or other parts of the city where there's not a birth center in their borough, they need to now travel to other areas in order to get access. Some of it is also the regulation that exists around opening birth centers, and the certificate of need being one of the big barriers that are stopping folks from wanting to open up these types of facilities to offer this type of care to birthing people. So that's what I'll say.
Does anyone else would like to share your experience and how it's affecting your immediate community?
I just think we have to continue to educate the public and highlight the fact that, because some people don't see the significance. They say, what's the big deal? Everybody gives birth in a hospital. What's wrong with that? Just send them to the hospital. But if we are going to continue to look at ways in which we can have a positive impact on the disparities for people of color, we have to acknowledge the fact that hospital settings, first and foremost, community birth is safe. That let's start with that. It is the safest, and I think that a lot of people are not aware of that. So there's research to be done, and people need to, educate themselves on that first and foremost. Additionally, you know, the hospital setting is not always the safest, especially for people of color. And because of that, and because of the experiences that they tend to have, people steer away, and or they feel that they have no other options and they're just subject to poor treatment or maltreatment. And I'm not saying that it's always that case, but it's too often the case wherein people are not being respected, people are not being heard, people are not being believed, and so our people suffer. And so we need to be able to provide these options to them because of these facts, simply because of these facts. So I just want to highlight that this is in fact important, and these conversations need to continue to happen, and then the actions need to continue to be taken.
Thank you. That's so true. I mean, there was a point where we all birthed at home. You know, that's the way that Black women were doing. We were birthing at home, and safely. I mean, you know, we understand that why the hospitals came in to play, but there's also a backstory to that. We're not going to delve into that part, but we know that we can have safe births at home. Like my colleague has had, him and his partner had 2 safe, healthy birthing outcomes at home. So yes, I know plenty. Matter of fact, there's someone that's in the media right now that's on TV, right? The Ellises, DeVal Ellis and his wife, they show that they're having their births at home, so they can be done healthy. And I want to thank you both for that. Does anyone else want to respond to that?
I think we also have to look at the mental health aspect, because when you're at home, when you're able to have, you know, a birth at a birthing center, the care is a little bit different. They're able to really focus on you a little bit more. They're not rushing. So some of your needs are able to be met more. When you look at the social emotional piece, because that is a major change and shift for both both parents, right? Not just the one with the womb. So we have to think about that aspect to the mental part.
Right, this is true. Miss Alexandria, since you have had this experience of having your children at a birthing center. So each person, this question is directed towards you, and anybody can respond. But I want to start with you, Alexandria. Mm-hmm. Each birthing person has a story regarding the birth of their children. Do any of the panelists want to share their birthing stories? Their birthing stories, and birthing stories, and how has that story come to the work of birthing people? So we'll start with you, Alexander, then whoever wants to chime in can do so.
No problem. So I did give birth to both of my children in a birthing center. My daughter's the oldest. She's 2 years old. I started off seeing her at an OB/GYN. While I was under that care, it felt like a revolving door. And it was also during the pandemic. I don't feel like they were giving me adequate care. I don't feel like they were really prepping me to have my first child. It wasn't until I went to the birthing center when I was about 6 months pregnant. I finally got all my documents transferred over. They accepted me, and they told me that my iron was low, like almost severely low. And that stood out to me because I'm like, okay, this is probably why women are just getting these C-sections when they're having these seemingly healthy pregnancies, because here I was getting my prenatal care at being overseen by an OB/GYN, and now all of a sudden, nobody told me that my iron was low. I go to a birthing center and they're giving me all the interventions that I can take to get my iron back up where it needs to be so that I won't have to get a blood transfusion, lose too much blood while after I give birth. And my experience with the birthing center, I loved it. Like Olufemi mentioned, they also took care of my partner. They made sure that he was okay. He was 100% involved in everything, every step of the way during the prenatal visits. And they gave me a lot of knowledge while I was at the birthing center as well, from how to take care of myself, how to take care of baby, making sure that I was okay, making sure that I had a doula, because they made sure that I understood that while being at the birthing center, while yes, they do care for mom, they are here to birth my baby and make sure my baby's okay. So I need to make sure that I have somebody who can advocate for me, not just my partner, but somebody who is knowledgeable, knows the terms, knows what to do in the event of anything. And I really loved that I just really felt supported. And I did not get that support when I was being overseen by an OB, which would have resulted in me going into a hospital.
Olufemi?
Yeah, Alexandria, thank you for sharing that story. And there's so many lived experiences. For myself, I ended up giving birth. My son is 11 now, and I ended up giving birth in a hospital and had a C-section. And had I had more knowledge, I would have been able to ask the questions, what are my other options? Could I have it at a birthing center? Why do I really need to have a C-section? And it's as I'm doing this work more and more, I realize that a lot of it is connected to the dollars, right? What the insurance pays out when you do a C-section as opposed to a natural birth or have a baby delivered at a birthing center. So I think it's so important to be able to continue to have this discussion and being able to ask questions, be okay with asking questions, and tapping into the community as well, to not just ask your immediate healthcare provider, but tap into midwives and doulas as well. Thank you.
Yes, no, thank you both for sharing your personal stories. Excuse me. Olufemi, I'm going to go back to you. Really quick. Systemic racism is plagued as the reason for health disparities with birthing people in New York City. In your work, would you have witnessed this? You want me to repeat it?
No, I just had a hard time getting off of mute. It kept going back on mute. But before I talk about the disparities, I wanna highlight some successes, because I agree with Shakima that we can't just focus on the negative. Let's focus on the positive. So I think out of some of the systemic racism is the city understanding the importance of doulas, providing doulas as well as postpartum doula programs for our historically underrepresented communities to give them the additional support. The systemic racism that still is very much prevalent is the fact that things are not culturally competent and culturally sensitive when we look at the birthing process. Because if you are culturally sensitive, you'll realize that with some cultures, there are certain things that they want or expect, and it should be offered to them, so they have a level of comfort with the process, rather than telling them, no, you can't have that. Because then that puts another level of stress on the families. We also have high infant mortality rates still. And even families that are affluent in our community have a high infant mortality rate because of the stress level that they are under from a variety of aspects. That's why I talk about intersectionality, the different industries that impact families. So we really have to look at that, as well as food deserts. There are some of us that are not in communities that provide healthy food options in order to provide the necessary nutrients to the birthing family. So we really need to look at that and figure out ways to collectively change that so our numbers are much better.
Does anyone else like to chime in on that?
Sure, I'll share. And thank you, Chiefess Olufemi. Just thinking about, in addition, just expanding and not assuming that this audience knows like about intersectionality, like, and how important that is, because thinking about some of the rights, the activism and rights around women's issues, how they were managed before, folks would collapse with women who were a stand for rights for women, but mainly white women, and their issues like would collapse our issues with theirs. And a lot of our issues were not met and needs were not met. So if you are someone who identifies as BIPOC, Black, Indigenous person of color, if you are not earning enough, either unemployed or under earning, because you can have a job and not be earning enough. The doctor just mentioned food deserts, living in a space where there are not adequate hospitals, or if there are hospitals present, they don't take care of your needs. Or if you have a mental health challenge, or if you have what is considered a disability or a neurodivergence, that you can end up being a person that is treated very poorly. And if you have multiple indices or intersecting identities, that are marginalized, and it can make it very, very dangerous for you to give birth in this city and then across the country. So it's so important for us to pay attention to this, and also not separate out infant mortality from maternal mortality, because how the mother is doing and the challenges that she faces, she is housing that baby. She has to eat, she has to be cared for, she has to be listened to, she has to be nourished well. The body has to be prepared to carry the baby and then deliver and then recover afterwards. So if you have all of these intersecting issues happening, and women living under, as was said by Dr. Olufemi, under great duress, whether it's conscious or not conscious, then it can create a situation where that person is in danger. And I'm saying women, but also birthing people, my apologies. It can create great danger for them as well as the babies that they give birth to. So it's super important for us to look at these pieces and be conscious of the fact that you can't be comparing apples to oranges. And in this case, it's comparing BIPOC women and birthing people to our white counterparts. It's deadly for us when that is done.
And I just wanted to jump in and highlight some things that Alexandria brought to our attention about the care that's offered at birth center. Oftentimes we have a smaller group of clients that in which we give care to, and we're able to sort of take note of the small things, whether it's blood levels, whether it's the family dynamics, whether it's the diet, nutrition, things like that. Those things make a difference on how the pregnancy is for each birthing person. And in the birth center setting, it's often highlight, and that's because it's usually led by midwives and midwifery care. And one of the hallmarks of midwifery care is listening to the patient that's in front of them and trying to figure out what their needs are, because nothing is sort of set in stone with each and every birthing person. Some people will need more information about childbirth education, while others will need more social support about their family dynamics that will change after their birth. And oftentimes we find birth centers offer those dynamics that they need, which are led by midwives. So I just wanted to highlight that.
Thank you so much, Trinisha. I'm going to jump back to Shakima. It's something you said earlier, but I want to jump back to you really quick. Can you speak to the solutions on how we can improve the infant mortality, morbidity, and mortality rate?
Well, I'll say, I couldn't agree more with Shawnee when she talks about how we can't separate, and we have to continue to look at maternal mortality. I mean, they're fluid, they're together, right? But the truth of the matter is, a lot of people want to highlight the fact that improvements are being made. Some of these terrible rates are improving somewhat, but they're still, I have to continue to emphasize, they're still unacceptable. So with Black infant mortality, I mean, it's still 2 to 3 times higher than that of white counterparts. So black babies and babies of color are dying at a rate that's more heightened than white babies. And so when we talk about access to care, like I mean, oftentimes we have these terms, these catchphrases, and it's like, what does that really mean? We have to really begin to define it and look at it concretely. And so creating places like birth centers wherein care is delivered differently, that's one of the ways in which we increase access. That's one of the possible solutions. And so Chief this was talking about money and the dollars, and oftentimes the way care is set up in a hospital settings is because of money, right? I mean, it's a business. And so people are scheduled to be seen in such short intervals. Time is not given to them. Time is not allowed to be given to them. Even providers who want to do better oftentimes are restricted by the policies and the protocols of the practice we're in there, or that department wherein they're working in that hospital setting. So when we look at birth centers, we have the opportunity to provide something more comprehensive to these families, right? Wherein we get to look at the mental health aspects. We get to look at, what's going to happen after baby gets here. We get to spend some time talking about feeding, And in providing that education, we can set up those support services. We can set up those long-term connections for these families so that they know who to run to. They know where to go when they maybe hit a pitfall, or maybe they, have a hiccup in the road. It looks a lot different when we consider the other options. So that's what we mean by increasing access to care. We need to look at meeting the needs of the families. If someone is hungry and cold, you're not going to be able to get them to focus on anything else until you give them a coat and a plate of food. And so what we need to be looking at is, how can we make this more convenient for our families? How can we provide a service or have the type of setting wherein it works around people's work hours, wherein, they get that time with the provider that's more than 5 minutes and they're being pushed out the door. The birth center model of care, and also midwifery philosophy and model of care can provide that. And I love the idea of being able to look at the other aspects that can be included within that care outside of just the birth, like the childbirth ed and the lactation support.
This Olufemi?
Yeah, I wanna take a moment to just define something, which is I know there's one definition that's used a lot for intersectionality. When I speak about it, I'm talking of different industries. I'm talking about housing, finance, agriculture, the criminal justice system, the workforce. All of those pieces. And when we take a look at how it impacts birthing families and how it impacts the families once the babies arrive and they enter school, then we can begin to have additional solutions to these historic problems that are still very prevalent in our melanin dominant community. 30 years ago, 50 years ago, we're still having these conversations today. And at some point, we have to say, what should we do collectively differently to have better outcomes and have sustainable solutions?
Right, and a lot of it, goes to legislation and given access, and you have a support from the Office of the Public Advocate, and we have the largest women-led in the city council in its history, and legislation is being passed, and we have the mayor who's also looking into the opening up birthing centers around the city. So yes, so you ladies are correct, and sharing your experiences and why it's important to have birthing centers in New York City, not just 3. We need at least 3 in each borough, not 3 in an entire city. I'm still staying on topic. Shawnee, I wanted to, if you can share, like, have you witnessed directly any intersectionality?
Can you explain what you mean? Like, you mean witnessed folks who have these different identities and impacts that Dr. Olufemi was speaking about, and them suffering as a result? Is that what you mean?
Yes and no, more if you might want to go into personal. So and it's on effects on babies. So I know you mentioned, your experience with your older daughter, Shimoni, and those intersectionalities come into play there. Would you like to share, the effects, on the grandchildren? Has it affected, forgive my wording. If you would like to share.
Sure. So I wanted to actually highlight just some of the privileges that my family had and my daughter had, because they just did a study. A report came out that some of the wealthiest Black or brown folk, women, birthing people, are dying at rates that are higher than the poorest white folk. That you can have access to resources, be living in the best spaces and places. And everybody refers to Serena Williams. Sometimes people refer to Beyonce, who had a near-death experience with her twins, that you can have all of those things in place and you can still be in danger of dying or still die. Like my daughter, not rich, but had access, information, covering by community, vocal, healthy, learned, had a doula, a midwife, and she still passed away. So we need to be looking at all of these pieces because there's something about being bodied as Black or brown or melanated, as what was said, that makes it unsafe for us. But I'm not only I a person that has experienced the loss of my daughter due to maternal mortality, but I'm somebody who's been working in the community for 32 years as a psychotherapist, and across systems in this city, in particular, how Black and brown folks get treated. And I worked in child welfare. I worked in substance abuse. I've worked in a contracted with educational spaces and provided work for them and support for them to serve students and families. And it's the same issues across the board, that when you are identified as Black or brown in this community, that judges look at you differently. When your children, they take your children and put them in foster care. So there's a lot of issues around racism and oppression and bias that creates almost like a, I can't think of the word, a police state. No matter where you are, at the hospitals, you're just viewed differently, and it just makes it unsafe. What I will say about my own, really quickly, about my own family's journey, and my family, once again, privileged enough to have a network that the story got out about my daughter's death, and then the community rallied around us because we've been present in community for so many years and serving for so many years. But there's so many people who don't have the privilege I have. For a year and a half after my daughter died, every single day up till a year and a half, people were texting me, calling me, sending me packages, checking on me. I always think about the families who don't have that level of access, and when they put the last bit of dirt on the grave, how nobody checks in at all, which creates more mental health, emotional, financial for those children that are left behind. My grandkids are covered, Anari and Kari, who are now 6 and 3. But what about the thousands of children whose mother or the birthing person died, and the parents are left to figure it out, or they don't have another parent to look out for them? And then also I think about, just those who don't have the resources, lost income, lost presence of a parent, all of the aftershocks, like the documentary is called, that impact the well-being of the families that's left behind in the communities that are left without their member to contribute. So I just wanted to speak about those things, and I'm complete.
And we wrap our arms around you and support and community support with you. We stand with you in your time of advocacy through this, through the tragedy that has taken place. And I wanted to add on to what you mentioned when we talk about disparities. You often, mothers and birthing people get looked at differently when they're not married as well. So when they see, and it's the baby daddy, you get, you get the doctor, the OBGYN that will say a reference, to the child's father, that there is a paternal parent that, is, oh, that's your baby daddy, right? But you wouldn't say that in another community,
right?
Yeah. So I just wanted to add on to what you said by highlighting that we get treated differently when we're not married as well. Like you can be married and not, but I'm just in certain communities, when they know that you're not married, they tend to look at you like you can't advocate for yourself. It's like, well, what do you know about family? You don't have a full family because you're just you're just a girlfriend. So I just want to just bring that into
really quickly. I'm glad you brought it up because I almost forgot about this. Bruce talks about this. Bruce McIntyre talks about this when he lost Amber, how they were like, okay, Mr. Baby Daddy, while he was in the hospital trying to support his partner when she was giving birth and in distress. But I also, in the documentary Aftershock, for those who have not seen it, there's a film that my family is in about the death of my daughter. And we were asked 4 times whether my daughter was on drugs or not. And I just don't think with another community they would have done that. We told them she just had a baby. She had a C-section. She wasn't even taking the medications, the pain meds, because she didn't want to be out of it, giving breastfeeding her baby. And so to be asked that so many times when we were in distress, I'm filing that in my head. I had to think about things that I ought not have had to think about when my daughter was in distress medically, because of how they were treating us and how they wouldn't listen to me when I was telling them the things about her. So I had to be an advocate. I had to be the activist that I am. I had to be the mother, and she died within 16 hours, but it's still in my body how they were talking to us and treating us in that space when she was fighting for her life. So I just wanted to say that it's tragic, and it's pathetic how the providers are trained and developed consciously and unconsciously to our people.
Absolutely. Amaduma.
I'm here.
Okay.
I changed rooms, and this is a much better setup.
Oh no, we hear you. We hear you just fine. We see you. I just wanted to, I want to bring you back into the conversation. So in your field, so what gaps in the current healthcare system would you like to be filled?
Well, there are many, but I will try to bullet it and narrow it down to the few, because I personally believe we need a paradigm shift around how we relate to our bodies, how we teach children and train young people to look at their bodies. I think we've been trained to be afraid of our bodies, and any bodily fluids or anything that comes out of our bodies is labeled nasty. And that's a very unhealthy attitude about our bodies. So I think we need a paradigm shift, and education is primary from preschool to graduate school, not only for people who are having babies, but we can't wait until people are pregnant to educate them about birth. They need to learn about it from an early age. And when we took birth out of the home, it became something that's fearful. People are taken away from the home. And I did a presentation recently, and 2 people in the group were traumatized because either the child had been separated from the mother, or one of the adults remembered being traumatized herself when her mother left the home to go to the hospital. She didn't know what was going on. It was the first time her mother was separated from her. But we need greater access to doulas in underserved communities. We need more collaborative relationships between doulas and other members of the maternity care team. We need an emphasis on patience. And what I mean by that is we have a few models. Centering pregnancy is one model. Jenny Joseph JJ Way is another model, where the emphasis is on the patients, not so much care provider led, but the emphasis is on the patients, and they get to support one another and learn while they're pregnant and receive their medical care. The midwifery philosophy of care can be embraced by everyone. You don't have to be a midwife to have that philosophy and understand what the body is capable of doing in birth. We need trauma-based care, and we need cultural humility. It's key. Providers can develop the habit and policy of listening to the people that they service. A lot of times, I think the providers want the patient to listen to them and what they have to say. But unfortunately, many times we've heard patients complain that nobody listened to me. People were not paying attention to what I was asking for, what I needed. I think it's important in childbirth education that people understand what their rights are, and that they have a voice, and that they should be a part of the team of decision-making around their birth. All birthing facilities and providers should increase their awareness about evidence-based benefits of doula care. And also, it's important that we focus on the postpartum period. So much can happen right after the baby is born. And a lot of people don't receive care until 6 weeks after they've given birth. And some people are not able to go back for their 6-week checkup. So a lot can happen. And this is a very important period that we've kind of forgotten. A lot of people don't make plans for their postpartum period. We glorify young people and babies, but we don't often prepare the family for what it takes to bring a new member into the household. And when a child is being born, if it's the first baby that someone is having, we have to realize the parent is being born as well. They haven't had this responsibility and this relationship before. So it's really important. I think we need more of an emphasis on breastfeeding also, because I believe that breastfeeding saves lives. It's been documented, saves mothers' lives and other birthing people's lives, and it saves babies' lives. And we could save For people who don't have the funds to buy the very expensive formula, breastfeeding is the optimal form of nourishment, and also it's important for bonding. It's not just food. So, there are many gaps, and I really would like to see a paradigm shift around how we relate to our bodies and how we deal with birthing in this society. I'd like to go back to when the grand midwives were catching the babies, and the birthing center is a very important piece of that. Person doesn't have to stay in a hospital for days. They don't have to stay in the birthing center. It's the halfway between the home birth and the hospital birth. And they're necessary, particularly in our communities where we've heard so many examples today of how our people are being treated differently. And so we need options, and the birthing center is a great option. I'm hoping to see more of them in our communities. Thank you.
Trinisha?
I wanted to definitely highlight all those gaps that were mentioned, but also mention a few more. One is that we really need some federal dollars behind educating more midwives. Even if we had a birth center every place we wanted it, we don't have enough midwives to be able to offer this type of care. So we really need some federal, state, and local dollars to educate more midwives and have more midwifery programs for that to happen, and better reimbursement of those midwives to get educated. And there's a lot of little nuances that go into the educational system. The next thing to keep in mind is that we do need to think about the certificate of need and how it is a barrier to being able to open up birth centers. And soon we'll have the Bronx Borough President's Office report. It should be released in the next month or so, that highlights the certificate of need as being a big barrier to being able to open up more of these facilities. So I consider that to be an additional gap. The next one is health insurance carriers to actually pay for this type of service. Midwifery service typically is reimbursed at a lower rate. Lactation services, most insurances do not cover. And we all know about the doula coverage. It just really doesn't exist. So we need to have those gaps filled by our insurance carriers in order to be able to offer this type of care. The next one too to keep in mind is malpractice insurance. That is another barrier to opening up some of these facilities. We need to have better malpractice insurance for midwifery coverage at an affordable rate. If midwives can't afford the insurance, it's going to also be another barrier to being able to offer this care. So those are the other ones I just wanted to make sure that we highlighted, as well as gaps.
There's one thing I meant to mention also, that there's a lot of fear around birth. There's fear on the part of the providers in terms of litigation. And there's also a lot of fear instilled in the people who are having babies. And it would be advantageous for our society in general if we could eliminate some of that fear, because the fear often causes the outcomes that we don't want. And so, we need doctors and midwives and people who are not so afraid of being sued. And we need people who are having babies who understand the natural process, so they're not so afraid of having a baby and not afraid of possibly dying when they're giving birth. It shouldn't be something that people have to worry about losing their life when they're having a baby, which is a natural process.
I wanted to say something, because Trinisha, what you offered up made me remember to talk about the fact that Shamani did have a doula and a midwife, but one of the things that's glaring for me is that because there's so few midwives of color in this country, and then also in the city where we live, that she, in my view, had a midwife that was oversaturated with clients and tired. And I jokingly say that when I see a Black midwife, and I'm so grateful to see the folks in this space, that it's like seeing a unicorn. And also, just doing the work for as long as I have been doing the work as an advocate and activist, that I've spoken to folks who are in midwifery school about the abuse and the discrimination in those schools, that it's a medicalized model, and that they're overpowered in the space. When you're BIPOC and in these spaces, that there's a lot of discrimination and mistreatment. So I just feel like we definitely need more midwives of color. We need their education to be covered, and they need to be taught in a more holistic space, so that what they bring to the table is honored, and we're not perpetuating the same systems and outcomes that we're talking about that are killing mamas and babies and birthing people.
Yes, Shawnee, I want to speak on that a little bit. There are schools that profess to be taking in people of color, and they take them in, but they don't report how often they allow them to graduate, because they changed the rules. And sometimes once we learn the rules, once we learn how to play the game, the rule is changed. And so that's what's happening in some of these institutions. And it's an abomination, literally.
You know how that goes. They keep moving the goalposts. The goalpost keeps going further and further back. Excuse me. Oops. So I am at so I'm now getting ready to.
Well, Farina, if I may, I just wanna share one other element, which is in higher ed and continuing ed. If we want to have the next generation of healthcare providers be very mindful, and not necessarily just the doulas and the midwives, but even the physicians, because at some point there's going to be some connectivity there. And the level of information, how the information is shared with regards to melanin dominant folks has to shift. I remember a few years ago getting a phone call from a family friend whose daughter was in medical school and was crying after her class because her professor said, you don't have to give melanin dominant folks as much anesthesia because they can bear pain more than Caucasians. So if information such as that is being given, what other information that is incorrect about us is being delivered so that the care that we truly need can be culturally competent? I'm done.
No, thank you for that. Thank you for adding that on. I would like to go into my final. We have our final questions. We have two last questions. So I'm back to Miss Trinisha. What do you see as the future of maternal health with birth centers in New York?
Well, I see that we will have more. Like someone here mentioned, maybe 3 in every borough. To be honest, we need 1 in every district. So that would mean more than 3, but let's start there. And I see that we have more midwives being able to provide that care. I do see our hospital colleagues as sort of coordinate with us and trying to help us to work with those families that may not be the best candidates to deliver at the facility, to allow us to have a safe space to transition our families into hospital settings. And I see our physician colleagues wanting to embrace midwifery and hope to have more birth workers like doulas, lactation folks to be available to be able to help support all birthing people. And I see maybe in another 5-10 years, a real shift, a real change, and have better birth outcomes for all birthing people, not just, people of color. Because right now, our numbers are not looking that great. I don't know if everybody's aware, but from 2021 to 2022, the CDC is reporting that the numbers have actually gotten worse. When you thought it was bad, it actually got worse. So I'm hopeful that we'll start to see some change once we actually implement these programs that we know are going to make change.
Anyone else want to chime in? So this is to all of the panelists. Anything that you want to leave the participants with as we wrap up to a close, in your closing, anything that you want to leave the participants with, thinking whether it's legislation, call to actions, anything that any upcoming event, anything that you want to get so we can really amplify and highlight this disparity and the need for birthing centers. I did mention I was the one who mentioned, at least we can have at least 3 in each borough. There is some movement, but it's not moving fast enough, as you just highlighted, Trinisha. Unfortunately, our numbers are growing from 2021, and now we're in 2023. And as we're coming up in April to Black Maternal Health Week, we want to make sure that we get more allies. Right. Again, our office is an ally. It's several people in the office, including the public advocate himself and his wife, that have been impacted myself included, and others. So we want to make sure that people are aware, right? There was a lot of things said, is the need for midwives, the needs for doulas, the needs for birthing centers. The conversation itself is the need for birthing centers, but with that comes the need for midwives, the need for doulas. And I wanted to highlight something that someone in this space often talks about is in that care for the birthing person, that we got to be mindful of the mental health of the doulas and the midwives, right? We want to make sure that they have good health, mental state of mind, that they're able to get their funds. We talked about housing, the intersectionality. So we want to make sure that the doulas and the midwives themselves are being taken care of with wraparound services, so that they can provide the most best and safe attention to the needs of the birthing person. So if you can popcorn style, or if you want me to call on you, I will. It's not a problem. We can popcorn style the last thing. So I'll repeat anything that you want to leave the participants with. We have we don't have any questions. Doesn't look like, but we have a lot of people who are chiming in on our social media platforms that are in agreement with you all, that are sharing some of their experiences. So again, anything that you want to share with the audience.
So I want to share that it's great to gather and share information, but I encourage everyone listening to this right now and later on, don't allow it to just stay there. The power is in amplifying our voice. So I encourage everyone to share some of the information, if not all of the information that you received here, and continue to do some more research so that you too can have a greater voice, because there's so much power in the numbers, and that's how we have done it historically, by having functional villages. So allow our village to continue to grow.
To piggyback off of what Dr. Olufemi just said, I think it's important for people to educate themselves around birth. You know, we spend time before we buy a sound system or a car, but sometimes people don't do the education required for birth. And I often use the analogy, you don't go to a vegetarian restaurant if you want a steak dinner. And some people think they wrote out a birth plan, which is really a misnomer. It should be a preference sheet. I would prefer to have this when I birth. This is what I would like to have. But the real plan is where you plan to have your baby. So if you're going to a hospital, for example, that has a 60% C-section rate, that your chances of having a C-section are increased greatly. So people really need to have an idea of where they're going, what they're doing, and who's on their birth team. That's a very important piece in preparation for birth, where you go and who's with you.
I'll go next. I want to make sure everyone who's listening would consider getting more involved. We are having a birth center rally on May 21st at Prospect Park. You can follow Haven Midwifery Collective on Instagram. So this way you can find out more about that once we start posting more. I would also encourage you to maybe consider getting involved in your local organization that's near you, whether that's a lactation group, whether it's a childbirth group. So this way you can find community to continue to advocate on these issues. So this way we can be able to make the changes that we need to do for our culture and moving ourselves forward. And if you feel moved, make a donation to Haven Midwifery. We're New York City's first nonprofit birth center, and we're trying to open our doors. And in order to do that, we'll need funding. So,
before the next person, Trinisha, what time is the rally?
It is at noon at Prospect Park on the entrance near Lincoln Road. But follow us on Instagram, and you'll see the link as we get closer.
I'll share next. A couple of things that I want to say, and then I want to announce something that I would like to invite the community to participate with. It's so important for us to integrate those who identify as men into the conversations around maternal health. Gone are the days when men wait in the lobby or the waiting area, and then they wait for the doctor to come out with the mask on. Is this a boy? Is a girl? No, men need to be in the conversation. They need to know how our bodies work. They need to know how to care for us. It's not acceptable for us to, for women, because I'm not having any more babies, y'all. But it's not acceptable for anybody who identifies as a woman or a birthing person to have to deal with whatever is happening with their body and be laboring and taking care of that sacred ritual, and then also advocate for themselves. Did you write that down? Can you take this? Like, that's too much. We already have to deal with so much already. So just making sure that our partners, for those who identify as men, and any partners in this space, are covering, and once the baby and mom or birthing person go home, that they're being taken care of and that the person understands what the needs are. The other thing I want to say is postpartum is forever. And my dear colleague and good friend, Chanel Portia from Ancient Song Doula Services, talks about that. I can still feel in my body my last birth with my son, who was almost 9 pounds. Postpartum is forever. And we're having an event, the ARIA Foundation, which is a foundation that I co-founded with my family in memory of my daughter, Shamani Makiba Gibson, who died in 2019. It's called the Ubuntu Giving Circle, and it speaks to us coming together collectively to do this work. And Ubuntu means I am because we are. And it's going to be at the historic King's Theater on Flatbush in Brooklyn, New York. The event is free. That King's Theater edifice is beautiful. We want the community to come out in large numbers. We're going to engage art, ritual, ceremony, celebration, and then also a call to action for the community, because it's the same week as Black Maternal Health Week. And then we're launching our national campaign, Postpartum Awareness Week campaign, so that we can be focused on postpartum and stop these deaths from happening. So I'm dropping the link in this chat for the Ubuntu Giving Circle. Prayerfully, we'll see you there. And thank you all for being in this space, listening and co-creating with us today.
And what's really quick for the listeners who may be in their car listening, what is the date and time of the event?
God,
I know it's Sunday.
Yeah, it's a Sunday. Thank you so much. April 16th from 4 to 9. And we'll be doing loads of stuff. Come early so you can get into the space. But April 16th from 4 to 9, and it's during Black Maternal Health Week, which runs from April 11th through the 17th.
And I just want to ask you one last thing, Shawnee.
Sure.
If you can tell the audience where they can view Aftershock. Is it still on Hulu?
Oh, absolutely. Yeah. So it'll probably be on there in perpetuity, but the Aftershock documentary is the documentary that was part of Sundance last year in January. It was picked up by Disney Hulu and shortly after Sundance, and then it was launched on Disney Hulu in July of last year. So if you want to watch it, please do go to Hulu if you have an account. If you don't, you can do a trial for 14 days and you can watch the film. People are showing it across the nation. I just came back from 4 cities where it was being shown. So please do watch it. And we're planning to develop a module or training module so that themes in the film can be used to train and develop people in hospitals and public health spaces and associations. So we are doing the work. It's not just for viewing and crying, it's for actually taking action.
Shakima?
Oh, I'll just say, and in the vein of taking action and helping people to understand that there's a need to take action, and also piggybacking on the talk about our rights and the rights of women and birthing people. There's oftentimes people are mentioning the New York City standards for respectful care at birth. And so these are standards that have been put out by the New York City Department of Health and the Birth Justice Defenders. And so you might see, or you should encourage people to look into that, look it up, your family members, people that that are considering growing their families. And so oftentimes you'll see the poster maybe in clinic settings or in hospital settings. But to me, what I want to focus on is not just telling people that such a document exists or such a poster exists. Many times practices and institutions have things up because that's just something that they were told to put up in the office, put this, hanging this on the wall. help our families learn what to do with that knowledge. What can they do about the fact that maybe they're not receiving respectful care in the prenatal period by their providers during the birthing period, while they're in a hospital unit. So I like to often help people understand beyond their rights around breastfeeding and lactation. What do you do if those rights are being violated? So let's encourage families that they can make complaints. They can file a complaint with the New York City Commission on Human Rights if they feel that their rights pertaining to the care they're receiving in and around birth have been violated. And that's something that they can access through calling 311. So I just wanted to highlight that.
Thank you so much. Alexandria? Yeah. Did we lose off the feed? Alexandria, I think, is she off the feed? And I'm gonna do my.
Yes.
Did you want to add anything?
No, I spoke. I spoke about the need for people to do the research.
No, I know. I just said Did you want to add anything?
Oh, I can't think of anything right now.
Okay. So I would like to add so one of our partners, which a lot of us in here know, Kimberly Seals Aller, has the Earth app. It's Earth. The B is silent for bias. It's the Earth app, and it's like a Yelp. It's a Yelp style for birthing people to leave reviews for the hospital that they attended, the good or bad experiences. Because people also go to the app to look for good doulas, doulas who got good ratings, and midwives that got good ratings in hospitals, and which hospitals give the best treatment. And so we want to make sure that people are aware that there is an app, a Yelp-like app, where you can give a review and you can read reviews in your journey to find the perfect midwife, doula, birthing center, hospital for your birthing experience. It's Earth, IRTH. The B is no B. We remove the B for bias. Is earthapp.com. And then also we mentioned some good stories, like everything. There are some great some healthy birth outcomes, and we also want to highlight that, like, yes, there is a disparity amongst Black and brown women and their white counterparts, but we want to make sure that people are aware of good birthing experiences, joyful birthing experiences. So I would like to share, there's a podcast that Kimberly Seals Allers also has, and it is called oh my goodness, it's called the birthright podcast.com. So that's birthrightpodcast.com. And you can give your share, you can share your great birthing experiences. You can listen to great birthing experiences as you plan out your preferred, as Amaduma says, your preferred way to give birth. And I just wanted to add on to what Chiefess Olufemi said. I use the phrase shared information should not stop being shared once you receive it. So as you're receiving information, please pick 3 people to share the information with. If you need to be in contact with the New York City Public Advocate's Office, you can contact us at gethelp@advocate.nyc.gov. Again, that is gethelp@advocate.nyc.gov. And I want to thank you, ladies, so much for sharing your experiences, your testimonies, and just and sharing in this space of advocacy to make sure that Black and brown birthing people have healthy outcomes, have healthy birth outcomes. As the NAACP has a phrase, we are done dying. So we want to make sure that we are surviving and thriving with our families as whole. So again, I want to thank you all. And
Can I jump in? I forgot. There's something as you were speaking. I thought of something
I
else.
knew you wanted to add. That's why I said you sure you don't want to add
Well, I'm glad you lifted up the Earth app. But Kimberly Seals Ellers also has a doula ambassador program where doulas can report their experiences, because as you may know, sometimes we receive vicarious traumatization witnessing some of the things that happen in some of our birthing families. But also the New York City Department of Health and Mental Hygiene and the Healthy Start Brooklyn program offers free childbirth classes. I teach a class on Thursday evenings. There's also a Tuesday afternoon class. And there are many classes and programs that are available through the health department. We have an infant safety and CPR class. We have a newborn care class. And people can contact Healthy Start Brooklyn at health.nyc.gov to find out more about the different programs. We have a fatherhood program. We also have a program helping the family to prepare for the newborn that's coming in. And all of these services are offered free of charge.
And what's that link? So we can drop it in.
Healthy Start Brooklyn at health.nyc.gov.
We're spelling out Brooklyn. We're not doing BK.
Excuse me?
So we're spelling out the word Brooklyn. We're not using
Yes,
BK.
Healthy Start Brooklyn at health.nyc.gov. And the childbirth class is an 8-session class. It's a very, includes a lot. I mean, we can't cover everything, but we cover a lot.
Okay, so I want to just repeat that. So that's Healthy Start Brooklyn at health.nyc.gov.
Correct.
Okay.
Thank you. Thanks for having this, and I'm happy so many people were able to participate.
Yes, no, it was, I mean, people, they were sharing their experiences. There weren't any questions, so that's why I didn't, pose them to you. I wanted to keep out, the conversation going, because y'all were giving so much information that there wasn't any questions that was asked, because y'all laid it y'all laid it out. It can't be any clearer for anyone who is looking to give birth. Like, these are, how to say, the 10-point plan. We need to have a preferred plan, how you need to have your team, your birth team. You need to know where you're going to want to give birth at. You want to know who you want to be surrounded by. Or do you want a midwife? Do you want a doula? Do you want both? Do you not want either? You want to make sure that if you're going to the hospitals, that it has the rating for in case you're high risk. You want to make sure that the hospital that you choose is certified to deliver your to have a successful delivery for you and your and the birthing parent and child. So I just wanted to highlight all of those things, because people, they say, the hospital's right here, I go to this hospital, but they're not rated to provide the services in case there is an emergency during the birth. So I didn't hear that mentioned. I just wanted to throw that in there as we close. And again, my name is Sheree Griffith, and I am the community organizer for civics and community empowerment. And I also organize the maternal health department at the office. And I want to thank you on behalf of the Office of the New York City Public Advocate, Jamani D. Williams, for joining us tonight. And that will conclude us. Thank you.